A COVID-19 infection may prompt autoimmune disorder, the Guillain-Barré Syndrome, finds a study. In the disorder, a person's immune system attacks the nerves, causing muscle weakness and occasionally paralysis. The condition is triggered by an acute bacterial or viral infection and can last for weeks or several years. Since the beginning of the pandemic, doctors have reported over 90 GBS cases following a possible COVID-19 infection. However, whether COVID-19 is another potential infectious trigger or whether the reported cases are coincidental is unclear. Our study shows that COVID-19 may precede Guillain-Barré Syndrome in rare cases, said Bart C Jacobs from Erasmus Medical College, University Medical Center Rotterdam, the Netherlands. But the existence of a true association or causal relation still needs to be established, he added. The findings are published in the journal Brain. Using an international collection of GBS patients known as the International GBS Outcome Study, researchers studied patients from January 30 until May 30, 2020. Some 49 Guillain-Barré Syndrome patients were added to the study during this period from China, Denmark, France, Greece, Italy, the Netherlands, Spain, Switzerland, and the UK. In this cohort study, 22% of the GBS patients included during the first 4 months of the pandemic had a preceding COVID-19 infection. These patients were all over 50 years of age, and patients frequently experienced facial palsy and had a demyelination form of GBS. Demyelination is a condition that results in damage to the protective covering that surrounds nerve fibers in the brain, optic nerves, and spinal cord. At hospital admission, 73% of the GBS patients with a COVID-19 infection had increased inflammatory markers. All these patients fulfilled the diagnostic criteria for both the GBS and COVID-19. Researchers here emphasized, however, that they did not find more patients diagnosed with the GBS during the first 4 months of the pandemic compared to previous years. This suggests that while a strong association between a COVID-19 infection and the GBS is not likely, a COVID-19 infection may sometimes lead patients to develop the disorder. Meanwhile, the GBS has also been linked with COVID vaccinations. It has been listed by the European Health Regulatory Body as a very rare side effect of the AstraZeneca COVID vaccine known as Covishield in India. The Johnson & Johnson vaccine against COVID, developed using the same technology as AstraZeneca, was also listed for the GBS recently. A study published in the peer-reviewed medical journal Annals of Neurology in June described an unusual variant of Guillain-Barré syndrome characterized by prominent facial weakness in 7 cases from a regional medical center in Kerala, India. The cases occurred within 2 weeks of the first dose of vaccination. 6 out of the 7 patients progressed to airflexic quadriplegia and required mechanical ventilatory support, said Bobby Varkari Maramattam from the Department of Neurology, Aster Medicity, Kochi, Kerala. The frequency of GBS was 1.4 to 10-fold higher than that expected in this period for a population of this magnitude. In addition, the frequency of bilateral facial weakness, which typically occurs in less than 20% of GBS cases, suggests a pattern associated with the vaccination, he added. News Desk, Kaumudy Global.